Mr. President, less than 2 miles from this Capitol, there are 666,000 small white flags stretching across the National Mall like a sea of suffering and loss. Each of these flags represents an American life lost to COVID. 666,000. Let me tell you about one of them. Her name was Candace Ayers. She lived in my hometown of Springfield, Illinois. Early last March, as soon as they could, Candace and her husband Terry received their second coronavirus vaccinations. That was the day of joy and relief for the family because Candace lived with rheumatoid arthritis, weakening her immune system. In July, she traveled to Mississippi, a state sadly with one of the lowest vaccination rates, to console a friend who had lost her husband. At the time, COVID infections were at a low point, and the Delta variant was just starting. So Candace thought she would be safe, having been vaccinated. Soon after the trip, she tested positive for COVID. Hospitalized, then moved to an ICU, she spent the last 3 weeks of her life on a ventilator. She died of COVID on September the 3rd of this year at the age of 66, leaving behind her husband, their son and daughter, and a 5-year-old triplet grandchildren. In her obituary, at State Journal-Register, my hometown newspaper in Springfield, Candace Ayers' family wrote, and I quote, "She was vaccinated, but was infected by others who chose not to be. The cost was her life." I read that to my wife the morning it was printed and said, I've never seen a sentence or two like that in any obituary. Experts who took Candace Ayers' life, who claimed it was a result of a breakthrough COVID infection, meaning an infection that occurs after an individual's been vaccinated. Breakthrough infections are typically mild, but they can be devastating for immunocompromised people like Candace. With the rise of the Delta variant, it's not just the elderly or immunocompromised who are at risk. At the start of this pandemic, children made up only 3% of COVID cases. Today, children account for 27% of COVID infections, and the school year is just starting. We're in the midst of yet another wave of this pandemic. COVID is once again overwhelming America's health system, and the rate of COVID infections and deaths are dramatically higher in areas of lower vaccination. An article in last Friday's Chicago Tribune tells the story in Illinois. Last Thursday was the 4th day in a row that every ICU bed in southern Illinois was filled. In a 20-county area, home to 400,000 people, there were no ICU beds available. Doctors, nurses, and first responders working around the clock to care for sick patients, but after 18 grueling months, they're reaching a breaking point. And with our healthcare system pushed to the brink, everyone is feeling it. If you live in southern Illinois and you have a heart attack, a stroke, a serious accident, or a life-threatening condition, bad news, there are no ICU beds available for you. Hospital staffs in those areas have to call hospitals sometimes hundreds of miles away in Nashville, Tennessee, St. Louis, Missouri, Kansas City, Missouri, to try to find a bed. Compare this situation to Chicago, some 300 miles away, but a world of difference. COVID infection rates are starting to decrease. Public health officials are hopeful they're finally turning a corner. Why the great disparity between the Chicago regional area and southern Illinois? One reason: vaccinations. In Chicago, 2 in 3 adults are fully vaccinated against COVID. In southern Illinois, the figure is only 1 in 3. So much of this suffering and expense could be avoided if we could take the politics out of the COVID debate and stop the spread of misinformation that is literally killing people. As Candace Ayers' family would tell you, the most important thing is that more people get vaccinated. Vaccines are safe, effective, and free, and widely available to anyone over the age of 12. Here's a statistic that should trouble everyone. The New York Times tracks COVID vaccinations around the world using figures supplied by national governments. Where do you suppose the United States of America ranks globally compared to other countries on vaccination rates? Well, you'd guess the top 3, right? Top 10 for sure. How about top 20? You would be wrong. The United States ranks 55th globally for the percentage of people vaccinated. We are just behind Cambodia. In the wealthiest nation on earth, and in the country that led the research and development in finding these vaccines, that is sad, it is inexcusable, and it's deadly. Now listen, all Americans respect individual rights, but the only way to end the pandemic is for everyone to accept their personal responsibility for our shared well-being. That is why I support President Biden's recent action to strengthen America's defense against COVID and bring this pandemic finally to an end. Many responsible employers, large and small, have already decided on their own to require that their workers get vaccinated. I encourage more to do it. A strong majority of Americans support this policy. President Biden's decision to extend that policy to much of the federal workforce and to private employers with 100 or more workers means that 2 out of 3 American workers will be required to get vaccinated. Mr. President, we even had a situation in the Federal Bureau of Prisons where the infection rate of federal prisoners is 6 times the national average, and yet fewer than half of federal prison guards are vaccinated. Fewer than half. That is inexcusable. Other nations have already instituted policies which encourage vaccinations. It's time for us to do the same. If we're ever going to see this pandemic come to an end, kids get back in school, and life return to normal, more Americans have to roll up their sleeves and face the reality that vaccination is the pathway to that result. Now, sadly, while this debate is going on nationally, politicians in 24 states, all with vaccination rates below the national average, are threatening to sue the Biden administration over its new COVID policy. In other words, these governors are saying to the president, stop any requirement for masks, stop any requirement for vaccinations. In the war against COVID, these lawmakers in these 24 states are siding with the virus. Their actions, if they follow through on these threats, will result in more illness, more death, and more harm to the economy. Now, how can I say that? Well, I'll tell you how. By taking a look at the numbers. Take a look at the numbers of the average of the 24 states threatening lawsuits. The infection rate, 3,471 for every 100,000 people. How about the other states that are not filing a lawsuit against President Biden? Coincidentally, almost half of the situation that we find in those 24 states where these attorney generals are standing up against President Biden. The death rate in the 24 states were threatening lawsuits against Biden, 31 per 100,000. The rest of the country, 11 per 100,000. Vaccination rate, 49% in those states, 57% in the states that are not suing the president. That tells a story. They are exalting liberty over life. This notion that we don't have a responsibility to ourselves and our family and innocent people to step forward is exactly the point that was being made by Candace Ayer's family. We do. We bear that responsibility and we should accept it. Mr. President, since June, the average rates of COVID infections in the 24 states threatening to sue Biden have been double the rates of COVID infection in other 26 states. COVID death rates in those states have been nearly 3 times worse than the rest of the country. These reckless political actions have deadly real-world consequences. President Biden's actions are reasonable, they're necessary, and a majority of the American people believe it. Politicians hoping to gin up their base by suing the president should stop and start fighting the virus instead of the president's ambitions to bring this pandemic to an end. The sooner we do that, the sooner we can end this pandemic once and for all. I yield the floor.